Hi everyone, I'm Dr. Charmaine Johnson from Premier Smile Center, and today I wanted to talk about some positive things about the coronavirus. We are so inundated with all the media and the news and how terrible things are, and everybody's just kind of uncertain and just don't know what's going on. But there are some positive things that have come out, and I made a list of a few things. For the first part, I just kind of wanted to let people know that, at the end of the day, our immediate risk of becoming seriously ill from this virus is still pretty low. And, it is much more of a concern for our elderly people, our, patients that are medically compromised, have lung disease, heart disease, and just immune systems that are down, and they are going to suffer more and have symptoms that are much worse. But for the most of it, we are going to see symptoms that are similar to the cold and flu, and our risk is still relatively low. One of the other things is, once we've been quarantined, if we do happen to have it, once we're quarantined and we've gotten over it and we're better again, we don't run the risk of infecting somebody else, and we're fine. There's also simple ways we can keep ourselves healthy, and the CDC has put out, wash your hands, use hand sanitizer, cough or sneeze into tissue, throw it away immediately, use a tissue to open doors. If you're sick, stay home. So there's many things that we can put into place to help us stay healthy. We also know that the virus is a weak virus, and that has a very weak lipid or fatty layer outside. So it makes it easier to kill. It makes it very easy to kill with just disinfectants. Solution of bleach will do it. Good old soap and water. Household disinfectants will do it. Alcohol, that is 60 or 70%. Alcohol solutions can do it, and just wiping down surfaces will kill the virus. Another thing is that, the WHO is reporting statistics of people that are actually recovering. I think last week they were saying that between 45 to 50% of people who are contracting the virus are actually recovering from it, and or have already recovered from it. We know that China has closed its last temporary hospital because there are not enough cases to support that hospital being in place. Apple has reopened all 42 of its stores in China. They have created a vaccine already, and they're fast-tracking the vaccine into human trials so that we can quickly try and get something out there that's going to be able to help us with the virus. And Italy, being one of the worst hit outside of China and having the most deaths, is a country that has one of the oldest populations in the world. It has statistically got 23% of its population is over 65, whereas in the US, only 16% of our population is over 65. And we know the elderly are more susceptible to, the higher mortality rate. And then lastly, children have been found to be not that affected by it, and they're not sure if it's because they still have lungs that are pristine and haven't been affected and by inflammation and the pollutions, allergies, and other diseases. So at least our child population is not as badly affected by it. So in essence, it's not all bad. There is a silver lining. But in the meantime, what we can try and do is practice some self-help or self-love. So take care of yourselves. Stay healthy, get good sleep, take your vitamins, eat well. Take care of your mental health, especially during this time. So listen to your favorite music. Put on a movie instead of the news channel. Put on something that's uplifting and funny. Take a walk outside. Reach out to your friends and family with WhatsApp and Facebook and Skype. Be patient and kind to others. We're all going through this tough time, and there's no need to fight over toilet paper or hand sanitizer or anything like that. Help your elderly neighbors or friends. who are immunocompromised and they can't go to the grocery store. When you go to the grocery store, get groceries for them. And one of the other things I came up with was, especially here in Broward County, the public schools are trying to get laptops out to their students so that they can do online classes, but they don't have enough. So if you have a computer that has a camera on it, because they do need a camera, that's just sitting around doing nothing, collecting dust, offer it to your friends' kids if they don't have one, so that they can get onto online classes as well. So just wanted to put some things out there, let you know that we are staying open for emergencies. We are here to help those people who are in pain, have swelling, broken tooth that is painful. We are abiding by the local and national guidelines for keeping everybody safe and healthy. And we are extending our phone hours so that we can help you answer questions as to whether it is an emergency, it's not an emergency, and try and help you take care of whatever oral health needs you need. So share this around to everybody if you feel that it's going to be helpful. And if you have questions, give us a call at 954-566-7479.